You're in the shower, you run your hands through your hair, and you see more strands than usual. The panic sets in. Should you grab a bottle of Minoxidil or talk to your doctor about Finasteride? Hi, I'm Dr. Angeline Yong, board-certified dermatologist and hair restoration specialist. I also subspecialize in hair disorders. In this video, I'll be talking to you about the differences between Minoxidil and Finasteride and what works better for you. Hair loss is one of those things that can sneak up on you, and it not just affects men. Women experience it too, be it after pregnancy, certain hormonal changes such as perimenopause or menopause, and certain other health conditions. And while there are many other products out there, both Minoxidil and Finasteride are one of the most well-researched solutions, and we'll talk to you about the differences between the two. Minoxidil is available in both topical and oral formulations. In the topical form, it can come either as a solution or foam and ranges in concentration from 2% to 5%. In the oral form, it can come from various dosages as well, ranging from 1 mg all the way up to 2.5 or 5 mg for some individuals. Minoxidil works by being a vasodilator and increases the blood circulation to supply the hair follicles. It also works by prolonging the anagen cycle, or what we call the growth or summer phase in hair follicles, giving rise to increased longevity of each strand of hair. Using Minoxidil consistently over a period of time will give good results. However, if the underlying condition is chronic, for example, in male pattern hair loss or female pattern hair loss, then stopping all medications altogether can give rise to subsequent regression as the condition progresses. Finasteride is typically more commonly available in the oral formulation but can also be made and acquired topically. So Finasteride basically blocks the miniaturization and gives rise to stronger, thicker hair follicles. It may not be as useful at regrowing hairs but actually stops or prevents further regression of hair follicles. Finasteride is typically used more commonly in male individuals but can also be used in women, especially those in the menopausal age group. This has to be more selectively deployed in younger women who are of childbearing potential and may fall pregnant. Finasteride is often better at strengthening hair follicles and preventing further hair loss than at regrowing hair follicles. So, it is not often one or the other. I often tell my patients that when looking at hair growth, it is like looking at a forest of trees. Minoxidil I see as a quantity regulator. It pushes new hair growth and prolongs each hair cycle, hence the quantity of hair follicles remains high. It's like having 100 trees as opposed to 80 trees. On the other hand, Finasteride works better at preventing miniaturization or blocking DHT, which means that it prevents your big canopy trees from shrinking to becoming smaller shrubs and bushes. And when you look at density of a forest as a whole, you want to look at both quantity as well as quality, and that keeps it dense. So in reality, sometimes using or deploying both might be better at protecting your hair from further hair loss. However, this also depends on your lifestyle and underlying health conditions and reservations about certain side effects of various medications. Finally, it also depends on the type of hair loss. For example, in telogen effluvium, which is very common and is also known as stress shedding, I typically prefer to use Minoxidil to kickstart the hair growth cycle and rebuild the hair follicles, and also keeping hairs in the growth cycle. On the other hand, when it comes to androgenetic alopecia or male pattern hair loss, then Finasteride becomes very important because the underlying driver is principally DHT. So here's the thing, there is no quick fix. It's not about getting the latest, hottest treatment in town or doing a once-off treatment like hair restoration surgery, especially when it comes to chronic conditions like androgenetic alopecia. This is because AGA happens over decades, and further protecting your ongoing hair loss is also important. It's like going to the gym or watering your plants. Consistency is really key. If you found this video helpful, don't forget to like, comment or subscribe for more insights and tips on hair health and dermatological content.